Lipedema is a chronic medical condition characterized by the abnormal accumulation of fat, primarily in the lower body. It most commonly affects the hips, buttocks, thighs, and sometimes the upper arms, while sparing the hands and feet. This fat buildup is often symmetrical and can cause the affected areas to appear disproportionately large compared to the rest of the body. Lipedema predominantly occurs in women and is believed to be linked to hormonal changes, often first appearing during puberty, pregnancy, or menopause. Despite its noticeable symptoms, lipedema is frequently misdiagnosed or mistaken for general obesity or lymphedema. One of the defining features of lipedema is the pain and tenderness associated with the fatty tissue. Patients often report a heavy aching sensation in the legs, along with easy bruising and a sensitivity to touch. The condition can lead to reduced mobility, emotional distress, and a diminished quality of life. Unlike typical fat, lipedemic fat does not respond well to traditional weight loss methods such as diet and exercise, which can be frustrating for patients trying to manage their symptoms without proper diagnosis or support. The exact cause of lipedema is not fully understood, but it is believed to have a genetic component, as it often runs in families. Hormonal influences are also thought to play a significant role, given the condition's onset during times of hormonal flux. Researchers are investigating the involvement of microvascular dysfunction and inflammation in the development of lipedema. As knowledge of the disease grows, so does the emphasis on recognizing it as a distinct medical condition rather than a cosmetic or lifestyle-related issue. Diagnosis of lipedema is typically clinical, based on the patient's history and physical examination. Imaging techniques such as ultrasound or MRI may be used to differentiate it from other conditions like lymphedema or chronic venous insufficiency. There is currently no cure for lipedema, but various treatments can help manage symptoms. These include compression therapy, manual lymphatic drainage, specialized physical therapy, and in some cases, liposuction designed to target the abnormal fat deposits. Raising awareness about lipedema is crucial to improving diagnosis and treatment. Many patients suffer for years without a proper explanation for their symptoms, which can lead to physical complications and psychological distress. Increasing education among healthcare providers and the general public can help ensure earlier detection and better outcomes. Ongoing research and patient advocacy continue to push for recognition of lipedema as a serious medical condition deserving of comprehensive care and support. Treatment options for lipedema focus on managing symptoms, improving mobility, and enhancing quality of life, as there is currently no cure for the condition. A key element of treatment is conservative therapy, which includes methods such as compression garments, manual lymphatic drainage, MLD, and exercise. Compression garments help support the affected limbs and reduce pain and swelling by improving lymphatic and venous flow. MLD is a gentle massage technique that stimulates lymphatic circulation and can help relieve discomfort. Low-impact exercises like swimming, walking, and cycling are recommended to improve circulation and maintain joint health without putting excess strain on the legs. Another important aspect of managing lipedema is nutritional support, although diet alone cannot eliminate lipedemic fat. A healthy anti-inflammatory diet can help reduce overall body inflammation and prevent additional weight gain, which can worsen symptoms. Some patients find relief with specific dietary approaches, such as a low-carb or Mediterranean diet, which may help reduce fluid retention and improve energy levels. However, weight loss efforts should be guided by a medical professional familiar with lipedema to avoid frustration or harm due to unrealistic expectations. For more advanced or severe cases, liposuction specifically designed for lipedema fat may be considered. This is not the same as cosmetic liposuction. Specialized techniques such as tumescent or water-assisted liposuction are used to safely remove the diseased fat while preserving lymphatic structures. This surgical option can significantly reduce pain, improve mobility, and prevent progression of the disease when performed by an experienced surgeon. Patients often need to wear compression garments after the procedure and may require multiple sessions depending on the extent of the lipedema. Psychological and emotional support also plays a vital role in treatment. Many individuals with lipedema struggle with body image, depression, and anxiety due to years of misunderstanding and misdiagnosis. Support groups, counseling, and therapy can help patients cope with the emotional burden of the condition. Mental health professionals familiar with chronic illnesses can assist patients in developing coping strategies and improving self-esteem and emotional resilience. Lastly, ongoing monitoring and individualized care are essential components of a successful lipedema treatment plan. Because the condition is progressive, regular check-ins with healthcare providers can help adjust treatments as needed and address any complications early. Multidisciplinary care teams, including vascular specialists, dermatologists, physical therapists, and nutritionists, can provide comprehensive support. With growing awareness and continued research, treatment options for lipedema are improving, offering hope for better management and a higher quality of life for those affected. Lipedema primarily affects women, with studies estimating that up to 11% of the female population may have some form of the condition. It is a gender-specific disorder in most cases, likely due to the influence of female hormones such as estrogen. Lipedema often begins or worsens during periods of hormonal change, including puberty, pregnancy, and menopause. These hormonal links help explain why men are rarely affected. When lipedema does appear in men, it is usually associated with significant hormonal imbalances or other medical conditions, such as liver disease or low testosterone. Genetics also play a significant role in the demographics affected by lipedema. The condition often runs in families, suggesting a hereditary component. Individuals with a family history of lipedema are more likely to develop it themselves, which means early identification in relatives can be helpful for prompt diagnosis and treatment. Although research is ongoing, specific genes or patterns of inheritance have not yet been clearly defined, which makes it difficult to predict who will develop the disease solely based on genetic risk. Lipedema can affect women of all racial and ethnic backgrounds, but studies and data collection have historically been limited, often focusing on white European populations. As awareness increases, healthcare professionals are recognizing that the condition is likely underdiagnosed in women of color. Differences in body fat distribution and cultural perceptions of body shape may contribute to misdiagnosis or delayed diagnosis in non-white populations. Increased training and awareness among clinicians are essential to ensuring equitable recognition and treatment across all ethnic groups. The condition typically emerges during adolescence or early adulthood, often triggered by hormonal changes. However, some women may not notice symptoms or receive a diagnosis until later in life, especially after experiencing sudden or worsening symptoms post-pregnancy or during menopause. Many women are misdiagnosed with simple obesity for years before receiving a correct diagnosis of lipedema. This delay is compounded by a general lack of knowledge among healthcare providers and the public. Finally, lipedema is more common among individuals who are also overweight or obese, although it is important to note that lipedema is not caused by lifestyle factors. Even women who are otherwise healthy and active can develop the condition. The presence of lipedema can, however, make weight loss more difficult, which often leads to stigma and further complicates diagnosis. As research continues, better demographic understanding will help drive improved diagnostic tools and treatment strategies tailored to the diverse population affected by this complex disorder. Thank you so much for tuning into today's video on lipedema. I truly appreciate you taking the time to learn more about this often misunderstood condition. Whether you're living with lipedema, supporting someone who is, or simply educating yourself, your presence here helps raise awareness and build a more informed and compassionate community. If you found this video helpful or insightful, please don't forget to give it a like. It really helps the channel grow and reach others who might benefit from this content. I'd love to hear your thoughts and experiences, so feel free to drop a comment below. Let's keep the conversation going and continue supporting one another through shared stories, tips, and encouragement. Be sure to subscribe and hit the notification bell so you don't miss future videos on lipedema, self-care, and other health and wellness topics. And if you know someone who could benefit from this video, please share it with them. Together, we can spread awareness and uplift those who need it most. Thank you again for watching, and I hope to see you back here soon.